I know your organization has a long-standing humanitarian presence in Gaza. How would you describe the living conditions right now since the latest wave of violence and the aid obstruction that we've seen for months now? Walk us through what your colleagues in Gaza are witnessing every day.
Honestly, I have no more words to describe the situation, and I think no amount of words can describe what's happening, this dire situation. What we are witnessing is an unprecedented man-made humanitarian crisis that is deteriorating on a daily basis. And it is not that the international community is unable to stop it, it is rather unwilling to stop it. And what we are hearing from our colleagues in Gaza is that they're describing it as a nightmare without an end.
And so how are your teams responding to this worsening situation? What are they able to do? How are they helping Palestinians in Gaza?
Despite all the challenges, despite repeated forced displacement, so some of our colleagues have been displaced up to a dozen times now, they're still able, trying to save and improve people's lives by providing life-saving assistance, such as rehabilitation and risk awareness, risk education on explosive ordnance. And they are trying to do so despite the lack of basic needs for themselves and also the lack of medical equipment and supplies. For example, now we are exploring to operate mobile clinics to be able to reach people in need, especially people with movement disabilities, because these people are not able to reach our centers, and it is, of course, an additional struggle without any fuel that's entering the Gaza Strip.
Right, I was going to ask you about that because we've seen, as you said, another round of evacuation orders in areas like Jabalia and North Al-Tufa. What options, if any, do people have right now to flee safely? And how are your teams able to navigate delivery of aid and to help them or even communicate with people who are constantly being forced to move?
It has been quite a challenge. We are constantly adapting our modalities of work, and most of the Gaza Strip now is under forced displacement orders. There is nowhere safe across the Gaza Strip. However, our staff are still committed to their noble mission to try and help people in need, and we are finding ways to adapt our work. And like I mentioned, one example is exploring this idea of mobile clinics to offer services for people in need who cannot reach us.
Thank you so much for speaking to us, Zaid, and giving us a picture there of the situation in Gaza. Zaid Am-Ali from the Humanity and Inclusion Organization joining us there from Ramallah.
Thank you.